Good morning. My name is Patricia Barcon and I'm a third-year medical student of West Visayas State University College of Medicine. Today, I will be demonstrating to you the 8-part eye exam. The first part of the exam is the distance visual acuity exam. In this exam, we ask the patient to sit or stand 20 feet away from the chart. We ask the patient to cover one eye and let them read the letters from left to right, then from top to bottom. Until such time that the patient correctly identifies only half the optotypes on a line, we note the corresponding acuity measurement shown at the line of the chart.
Okay, do it with the
We repeat the steps for the other eye.
E, F, P, T, O, Z, F, E, L, O, P, Z, D, D, E, F, E, O, T, F, C.
Okay, now do it with both eyes.
We then retest the acuity with the patient using both eyes
L,
simultaneously.
P, E, C, F, D, E, D, F, C, Z, P, F, E, L, O, P, Z, D, D, E, F, P, O, T, E, C, L, E, F, O, D, F, C, T.
If the patient cannot read the biggest optotype, that means he has low vision. The examiner can use his hand and ask the patient if how many fingers are shown. If the patient still cannot identify counting fingers, the examiner can wave his hand and ask the patient if he can identify the moving hand. If the patient still cannot see the examiner's moving hand, use the pen light and direct it on the patient's eye in all directions. The second part is the external eye examination. In this exam, you observe the patient's skin for any dermal or vascular changes. You also note if there are any lesions or evidence of trauma or any significant asymmetry of facial bones. We also note for the lid position and the effectiveness of eyelid closure. We palpate for the bony orbit for any lesions or deformity. The third exam is the pupillary exam. We turn off the light to decrease the room illumination. We then ask the patient to stare at a distant target. Shine a bright handheld light directly into the right eye by approaching it from the side. We then record the direct pupillary response to light in the right eye in terms of briskness of response. We then observe the consensual reflex by noting the response to the light of the non-illuminated pupil, which is the left eye. Repeat the steps for the left eye. For the normal swinging flashlight test, we begin with a dark room. Let the patient fixate at a distant object. We then shine the pen light into the right eye and swing to the left eye and swinging back to the right eye. Both pupils should remain constricted. Relative afferent pupillary defect is a condition in which pupils respond differently to light stimuli shown in one eye at a time due to unilateral or asymmetrical disease of the retina or optic nerve. The fourth is the motility examination. Position yourself in front of the patient. Ask the patient to look straight at you. Hold a finger out or a small fixation target at eye level about 10 to 14 inches in front of the patient. Ask the patient to follow the target as you move it into the 6 cardinal fields and up and down along the midline. Then, we note whether the amplitude of eye movements is normal or abnormal in both eyes. We also note for nystagmus that may be present. In testing the Hirschberg method of corneal light reflection, we hold a pen light in front of the patient's eyes at a distance of approximately 2 feet. We direct the light at the midpoint between the two eyes of the patient. Instruct the patient to look directly at the light. Then, we compare the position of the two corneal light reflections and record the estimated result. The fifth test is the visual fields or confrontation test. We seat the patient and make sure that the eye not being tested is covered.
Focus on my nose or my eyes.
We close our eye that is directly opposite the patient's occluded eye and ask the patient to fixate on your nose or your open eye.
1,
Quickly extend, then
2,
retract the finger or fingers on one hand in one quadrant
1,
of the monocular field, asking the
3,
patient to state the number of
2,
fingers seen.
2, 1.
Okay, so now cover your other eye for me.
We repeat this in all four
Focus on the
quadrants,
other.
testing at least twice per quadrant.
So let's start now. 1, 2, 2, 1, 3, 2.
We then diagram the confrontational field if an abnormality is detected. The sixth part of the eye exam is the measurement of the intraocular pressure, and there are 3 different ways of measuring it. First, there is the Skiot's indentation tonometry, second is the Goldman applanation tonometry, and third is the palpation digital tonometry. The first one, which is the Skiot's indentation tonometry, measures the amount of corneal indentation that is produced by the presence of a weight or a force. Second is the Goldman applanation tonometry, which measures the amount of force that is required to flatten the corneal apex at a certain or standard amount. The third one is the palpation digital tonometry, which uses an examiner's hands in order to palpate the globe of the eyelid. It may be either hard, like the forehead, or soft, like the cartilage on your nose. For the direct ophthalmoscopy exam, we position the patient about 2 feet away. Turn off the light to dim the room illumination. We then set the focusing lens of the ophthalmoscope to 0. Obtain the red reflex by examining the patient from a distance of 2 feet. Approach the patient's eye. The instrument is steadied against the patient's face by resting the ulnar border of the hand holding the instrument against the patient's cheek. The thumb of the free hand raises the upper eyelid. After focusing on the pupils, dial the focusing lenses until the image of the retina becomes clear. Examine the emerging vessels for any pulsation, note if tortuous, note if there are any presence of hemorrhages and abnormalities like lipid deposits. We can find the optic disc by following the retinal vessels. For the optic disc, we note the shape, size, and color of the disc along with the degree of cupping. For the optic nerve, we note the size of the optic nerve if it's swollen, and note its size relative to the cup and the discs. The macula is examined for abnormalities. Sometimes there are media opacities, such as cataracts or corneal opacities, that may hinder your ophthalmoscopy. Assess the 4 quadrants of the retina and check for the foveal reflex. The last part of the exam is a slit lamp examination. A slit lamp has various parts. It has a headrest, a chin rest adjustment, handlebars, support pad, joystick, viewing arm, eyepiece, magnification, objective lenses, light, illuminating arm, a measure of the slit height, a slit height control, slit width control, and the pupillary distance adjustment. The slit lamp has also various uses. It can be used to examine the anterior segment of the eye in detail. It is also useful in measuring lesions in the anterior segment of the eye. With the Goldman applanation tonometer attachment, it is also used to measure intraocular pressure. Lastly, with the use of special lens, it can be also used to view the retina. And that is all for the 8-part eye exam.